User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening and welcome to You and Your Doctor, brought to you by All County Healthcare. All County Healthcare is a Medicare certified home health agency for all of your needs in the Tri-County area. You can reach out to them at 954-717-7027, info@allcountyhealthcare.com. I'm filling in for Louise Gomez tonight. I am Dawn Graubert, and I am honored to be here. I have the pleasure of interviewing Dr. Sameea Husain of Baptist Health. She is a neurologist, director of movement disorders at the Neurology of Marcus Neuroscience Institute, which is part of Baptist Health. Everyone has seen the Marcus Neuroscience Center all over TV. You hear it. It is just a pillar in our community. So welcome, Dr. Husain. Thank you so much for having me. Tell us what it's like to be at Marcus Neuroscience Center, to be at that level of care.
Well, you know, I have been there since the beginning, since the doors opened, and the growth has just been astronomical. We have all disciplines of neurology available: neuromuscular, epilepsy, movement disorders, all disciplines of neurosurgery. We're really a center of excellence, and I'm really proud to work there.
Now, I know I have all the questions for Parkinson's, but I just want to clarify to people, what are movement disorders versus your bread and butter neurology?
So movement disorders are specific to really the phenomenology of how a person moves. So a lot of my visits are centered upon my observations and really what my exam tells me I'm seeing. So sure, I order studies and tests and diagnostic ancillary exams, but the way a person is moving can tell me textbook what diagnosis I'm dealing with. So largely what walks through the door for me is Parkinson's disease, essential tremors, cervical dystonias, balance issues, among other things. So I feel very grateful to be there because there really is a lot of need in our community for movement disorder neurology.
And you talk about Parkinson's disease. Prior to diagnosis, somebody comes to you. What are some of their concerns that you would be looking for and they would say, I need to see a neurologist?
So it actually occurs in reverse. And what that means is that typically a primary care or perhaps a general neurologist might pick up some signs and symptoms that make them suspicious for a movement disorder, specifically Parkinson's in my book. And that would hopefully prompt a movement disorder consultation. And then they would walk through the door, and really I would help clinch the diagnosis and help move forward with a treatment protocol.
And what type of treatment protocols do we look at? Where do you start?
So Parkinson's disease is a clinical diagnosis. We do have some ancillary testing, namely an MRI brain, a dopamine scan, looking at whether the patient is making dopamine, a skin biopsy that I'm doing, which is fantastic, that came down the pike a few years ago. So in addition to the exam, if I feel it necessary, I'll order some additional testing, and then we move forward with treatment, which at this point, you know, I feel very lucky to have so many resources at my fingertips, which include medications, orally, injectable, patches. We have pumps that have come down the pike now, surgical options that are available, which, by the way, Marcus, you know, of course, provides. So really, we are a one-stop shop when it comes to movement.
So Parkinson's, it's a movement disorder. Does it affect cognitive status?
Yes. And, you know, this is a disease of 65 and older, typically in males, 3 to 2, as compared to females. So, you know, this isn't one of those diseases that typically afflicts younger folks. Now, there are young onset patients, which I have many of. But the older folks, as they do get older, there is sort of this overlay of cognitive impairment that affects the majority of patients the longer they have the disease. But one has to wonder if perhaps they would have, sort of been afflicted with cognitive impairment anyway.
Right.
So we take it all into account and we treat it all. We have neurocognitive neurology if necessary. Naturally, I manage everything, but if necessary, I have everything at my fingertips for the patient.
Why is it predominantly man to female? Is it a genetic component?
Absolutely. And that genetic component is 75 to 85% of cases. Now, we've only identified genetic predisposition in a couple of different populations. One of those is a North African tribe called the Berberi Arab tribe, which is very interesting, but also in Ashkenazi Jewish patients. We have not identified the genetics in other folks because naturally the world is filled with Parkinson patients and it would be difficult to lock in those genetic mutations. But given that there is some genetic predisposition, it does increase your chances if you are of one of those ancestries and if you have a family history.
Which is interesting. So my grandfather had Parkinson's disease, so as my mother now does not walk based on other complications. So she's now being tested, and whatever movement disorder she has, they label it as non-Parkinson's. But there's definitely a movement disorder. But I'm wondering if without the label, are there still treatments for movement disorders? Absolutely.
And in your mother's case, and in many cases, ataxia, which is a fancy word for balance disorders, can absolutely resemble other movement disorders. But that's really the reason to see someone like me. A movement disorder neurologist can discern, is it a movement disorder or is it balance issues, let's say from an aging spine, okay, or maybe from cognitive impairment, or from some other neurological condition that would really warrant perhaps other resources, other types of neurologists to assist.
And I know you talked about medications and patches, and I'm sure things have changed. Are there other, not that those are invasive, but other homeopathic exercise, balance, PT, things that people can do to help with balance and movement, even as they're going through the progress with you?
Absolutely. And for me, recommending things like physical therapy are first and foremost. If a patient is motivated, able-bodied, and ready and willing to exercise, I oftentimes recommend several things. Walking in the shallow end of a swimming pool, Tai Chi, yoga, Pilates, okay, stationary bike. So there are many things patients can engage in that won't necessarily slow the progression because, as we all wish in movement disorders, that's the holy grail, but it can at least keep symptoms at bay enough in conjunction with the meds that their quality of life can be what they want it to be.
Right, and that's what we want, is people to have an active quality of life.
Of course.
Pick up their grandkids, go to the grocery store.
Travel.
Do a lot of other things. And there's different stages of Parkinson's?
Absolutely. I would never typically capture a patient in the very early stages, which would be stage 1. I capture patients more in the stage 2 era, simply because that means that their symptoms have migrated from one side to another. That's definably what Parkinson's is symptoms on both sides. And you might ask what those stages include. Stage 2 is typically slowness of movement, stiffness of their muscles, rigidity, tremors, and balance issues. And I want to make it clear that 70% of patients with Parkinson's have tremors, but 30% do not. So it would not preclude you from seeing someone like myself simply because you don't have tremors, but perhaps you have the other symptoms. Because oftentimes patients will say, well, I never had tremors, so I didn't think I needed to be evaluated. And I often say, well, gosh, I wish you had seen me sooner. So stage 3 is where balance issues come into play. And that really is a major transition for patients to go from stage 2 to stage 3 because there is no medication for balance. Balance is, and something that, I'm sure they're going to recommend to your mother, largely treated by physical therapy, core exercises, leg exercises to keep that core strong, and an assistive device, which, listen, patients are oftentimes resistant. But I'll be honest, at the end of the day, I'm so inspired by these patients that choose to use one. In fact, I had a patient yesterday telling me how fabulous her new walker was, because her balance had become as such that she knew she needed one, and she got one on her own. This happened between visits. So it's really cool to see people take charge of their life that way.
I saw a lady who had a walker. She had it all blinged out. She had the bar was blinged out, and she was so, I don't know whether she had Parkinson's, but she was using it as an assistive device, able to go about her day, and she just felt as if she was empowering herself, and why not?
And it's almost like, you know, instead of using or thinking about your pride and your vanity as a hindrance to using the assistive device, they're almost proud to say, I'm taking charge of my life. I'm moving forward, because acceptance for whatever movement disorder it is, balance issues, Parkinson's, whatever, acceptance is the key. Then you're able to move on and get your life back and not let this movement disorder identify you.
And I love that we have all the questions on what is Parkinson's and all the stages. But ultimately what you're saying is what our goal is for all patients and for people and for family members. You want them to be able to celebrate holidays, to pick up the kids, to travel, to have their day-to-day daily activities, grocery shopping, and feel as if you can get out of the house because your own self-confidence is there. Well, it doesn't matter what anyone else thinks, but for you inside, right? We've all worked our whole lives. We don't want to get to a point where we're going backwards.
Of course.
And that's where you come. You're so important.
And the narrative that I say to my patients on a daily basis, I would say, is that your narrative doesn't change. Nice. The narrative doesn't change. You want to be in that, you know, marathon, run. You want to travel abroad, go. You know, it's so endearing, you know, at these visits with my patients, they say to me, well, we really want to go to Israel, or we really want to go here, or we really want to go there. What do you think? And I say, go. Please go. Naturally, you need a support system, a team, you know, perhaps assistive devices, whatever it is that you need to put into place to allow these things to happen, whatever they may be. Maybe it's something as simple as going out to eat. You know, we small wins, I always say, are the best. So I encourage people to live their life, allow me to help them do so, and really take charge and be the best version you can be, which of course requires discipline, taking the recommendations about medication, exercise, and whatnot, you know, not at face value, and then just pushing on.
And I love that you're so honest and authentic, because you want patients to have their best quality of life once they get the treatment that they needed. And I'm sure it's all individualized on who gets what, right? Not every patient that comes to you is going to get the patch or the pill. What are you looking to balance with Parkinson's? Is it the dopamine receptors?
Well, it's an amalgamation of a lot. You know, I wish that it was just dopamine, but boy, do I ask a list of questions, simply because there's so many different issues going on with the disease. You know, besides the motoric features that I mentioned, you know, there's bowel issues with constipation and insomnia and acting out our dreams and memory issues and psychosis and swallowing and drooling. I mean, the list goes on and on. So it really is a very thorough, in-depth visit that you get with me, because I just really want to give them my all. So that oftentimes requires more than just the dopaminergic medications. It's ordering the right therapies, recommending the right over-the-counters for, you know, swallowing and bowels and whatnot, just so that they have all their pieces in play, so that they can, again, leave the heavy lifting to me and just live their life.
Well, it would include swallowing studies, change in diet?
Perhaps, if there's choking, whether it be on food, liquids, or pills, we have recommendations for all. If a speech therapy consult is necessary, we will do it. To your point, yes, swallowing studies to sort of lock it in, how severe perhaps the swallowing deficit is. Same with physical therapy. Sometimes my patients are elated to tell me they say kicked out of physical therapy because they did so well. And that warms my heart, you know, because I want them to feel good. I never want them to feel like this disease is taking over their life. But again, we have to be open to all the recommendations. And I have to tell you, I never get pushback. It's incredible. I never get pushback. Whatever I say goes, because they know that I am a real person and I'm coming from a place of love, and I just want them to feel good.
We're going to take a quick break, and that's why people are going to come see you at Baptist Hospital. So we're going to take a quick commercial break for All County Healthcare. When we come back, more with Dr. Husain of Neurology at Baptist Health and the Marcus Neuroscience Center. More to come. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, and welcome back to You and Your Doctor, sponsored by All County Healthcare. You can reach All County at 954-717-7027 or info@allcountyhealthcare.com. All County Healthcare is a Medicare-certified home health agency. They have everything from skilled nursing, physical therapy, respiratory services, disease management, home health aides, as well as IPV devices to help with breathing. We are here today with Dr. Husain, who is at Baptist Hospital. She was a neurologist with the Marcus Neuroscience Center. We were just getting into all the fun conversations as to why go see Dr. Husain. Once we've identified Parkinson's, or your physician says, I suspect a movement disorder, how do we have a quality of life? What are we looking to do? And I love that people can come see you, and it's not just you. You've got a team at the Marcus Neuroscience Center.
Absolutely. I mean,
tell us about some of the modalities.
We tout ourselves as being kind of a one-stop shop, meaning in addition to myself, as I mentioned earlier, there are other disciplines in neurology that if necessary I can lean on, whether it be to get a more thorough cognitive evaluation if the memory is sort of declining and becoming more of an issue. We have physical therapy, occupational therapy, speech therapy at our beautiful Gloria Drummond Center. We have neuropsychology who can do the neurocognitive testing where, before we would have to outsource that to neuropsychologists in the community, but now it's right there at our fingertips. We have neurosurgery, which I think is an important point because oftentimes people don't even know there's surgical options, but the surgical options that are available are right there on site. Operating table is upstairs, and I am, colleagues with these people. So the beauty is I can get you to these people very, very quickly, if not right away, and get the process started if a surgical option is viable.
The beauty of the Marcus Neuroscience Center is exactly that. And I know Baptist itself has everything. They even offer Pilates, and they offer exercise mindset classes, because a lot of this, when your spouse or your loved one is with you, it's a change of life, as normalizing as you can make it for them. It's a change of what's happening next. And I know that those support groups that they have are really important.
Absolutely. And the support groups are the cornerstone for helping that acceptance that I was speaking of earlier, and allowing not only the patient, but perhaps family members, caretakers. Many folks in our community have caretakers that are like family members, to be honest. And everybody can go and get educated and feel good that they're doing their best at home between visits, because that's really the name of the game. You know, I always tell patients, don't let me be the last to know if there's an issue. And oftentimes it's not even the patient calling, it's a spouse or a partner or a family member or an aide or someone in the team, a primary care physician. Anybody can call me and let me know, immediately. And I move heaven and earth to get my patients in, because it's really not a disease where you can delay. You want to move quickly. And so for that reason, I sort of pride the team for helping me to do that. I have a really great staff that the schedulers take what I say as sort of off to the races, and they help me get these patients in quickly.
What's a good way for people to contact you?
So the phone number is 561-955-4600, and that would really be somebody answering the phone that, listen, we're a tight-knit group, so they know me by name. So one would simply have to mention Dr. Husain and that they need a movement disorder consultation. I always appreciate if anybody could be a little bit more specific, because it helps guide me a little bit in terms of the visit. But if not, that's okay. I'm happy to start from scratch with anybody that needs me.
What's that look like with Medicare and referrals from a primary?
Medicare is typically not a problem whatsoever. There are some insurances, of course, that require referrals through the primary care physician. And typically with our referral department, they will have obtained the referral prior to them even coming. So that would never be an issue.
And brain stimulation, I know we briefly touched on it. Is that a surgical procedure?
It is. Okay. And it's something that in movement disorder fellowship, we are trained very critically on how to largely identify candidates for deep brain stimulation surgery. And identifying candidacy is honestly half the battle. Once you identify a patient as being an appropriate candidate, there are protocols that we engage in, namely establishing care with our functional neurosurgeon who does the deep brain stimulation surgery, Dr. Timothy Miller. Secondly, we have them get neurocognitive testing. You always want to have that done just to make sure that the patient is a good candidate, both from a cognitive and personality standpoint. Next would be, there's some MRI brain studies that need to get done. This would be as per neurosurgery. And finally, there's some additional testing that I would need to do in terms of their exam to really lock it in and solidify that they are indeed a candidate. And once all these players are in motion and everything is locked in, they are getting pre-op clearance and they are having surgery.
I can't believe the level of specifics of how everything is just so super scientific and all the outcomes and so many specialists that you can have now. Back in the day, you saw your neurologist, you got your dopamine, and you prayed it either worked or it didn't, and you just dealt with life. Everything has changed so much. There's so much more hope.
Well, in addition to deep brain stimulation, a couple of different pumps have come down the pike this year. So these pumps are twofold. One is a sub-Q pump, kind of like an insulin pump. Okay. So it's worn on the belly, the abdomen, like right around the belly button. And just like an insulin pump, there's a little catheter with a needle. The needle, of course, is removed once the catheter is implanted. And it's on your skin all day and night. And it's infusing Cinemet or dopamine. Okay? But a, infusion, formulation of it. It's incredible. And it absolves patients of needing to take these pills all day long. Which, by the way, where it's implanted or placed, rather, the pump, it completely is absorbed in the gut. And moving past the stomach and being absorbed in the gut, the efficacy of the medication skyrockets.
That's incredible.
It is. And the other pump is an apomorphine pump. Also largely absolves the patient of needing to take daytime medications. And I am so thrilled to use them. Right now they're in the newish phases, meaning, insurance coverage is being sussed out and some other things. But everyone brings everything to me first because they know I'm going to use it. And that's sort of, I think, the reason why I love the autonomy that I have at the Marcus Neuroscience Institute, because I can do what I feel is best for the patient and no one stands in my way.
We've got about 2 minutes, and I have to ask you, why did you specialize in neurology?
So there's a family connection. My parents are physicians. My dad's a radiologist. My mom's a neurologist. And believe it or not, she's still kicking, going to be 79 and still practicing.
Wow.
So I had really, really good role models. I guess you could call it the family biz, but neurology has just been something I've been exposed to, and it's near my heart.
All right, tell us again how people can reach you.
So you would call 561-955-4600. Ask for me specifically, Dr. Husain.
Amazing. Thank you so much, Dr. Husain.
It's been my pleasure. Thank you so much.
Such a pleasure to get to meet you. Contact Dr. Husain for more information. Call her directly. They will get you in with the right specialist that you need. And if you're looking for all-county health care, you can find them at 954-717-7027. Have a great night, everyone. I'm Dawn Graubert, and we'll see you next week.